Welcome to our deep dive into tetracycline, a powerful antibiotic with a wide range of uses in medicine, especially in periodontal therapy. In this video, we'll explore its origins, mechanisms, effects, and important considerations. Whether you're a student, healthcare professional, or simply curious about antibiotics, this guide will help you understand why tetracycline remains a staple in antibacterial treatment. Let's start by uncovering what tetracycline is and how it was first discovered, setting the stage for its role in modern medicine. Tetracycline is derived naturally from the bacteria Streptomyces, or produced semisynthetically. This dual origin allows for a variety of tetracycline compounds, each with unique properties. The natural extraction process paved the way for semisynthetic modifications, improving efficacy and safety. Understanding its origin helps us appreciate the advancements in antibiotic development and the importance of microbial sources in medicine. Tetracyclines are classified as bacteriostatic antibiotics, meaning they inhibit bacterial growth rather than killing bacteria outright. This action is particularly effective against gram-positive bacteria, though they also work against some gram-negative strains. By preventing bacteria from multiplying, tetracyclines give the immune system a chance to clear infections. This mechanism is central to their use in treating various bacterial diseases. One of tetracycline's standout features is its effectiveness in treating periodontal diseases. This is largely due to its high concentration in gingival crevicular fluid, which can be 2 times greater than in serum. This targeted action makes tetracycline a preferred choice for dental professionals managing gum infections and inflammation. Its ability to reach the site of infection efficiently is a key reason for its widespread use in oral health. Tetracycline acts as a chelating agent, binding to calcium, magnesium, and aluminum ions in the gastrointestinal tract. This chelation affects absorption, especially with calcium, leading to poor uptake if taken with food. Therefore, it's recommended to take tetracycline either half an hour before or after meals. Understanding this property is crucial for maximizing the drug's effectiveness and avoiding reduced absorption. Tetracyclines inhibit collagenase enzymes, which are involved in tissue breakdown. These enzymes come from various sources including fibroblasts, epithelial cells, macrophages, and neutrophils. Notably, collagenase from neutrophils is more susceptible to tetracycline-induced inhibition. This property is significant in periodontal therapy, as it helps preserve connective tissue and prevent further damage. Tetracyclines possess antiproteolytic and anticollagenase properties, making them effective in stopping or inhibiting bone resorption. They can inhibit bone loss induced by parathyroid hormone, prostaglandin E series, and bacterial endotoxins. This action is particularly valuable in dental and orthopedic treatments, where maintaining bone integrity is essential for patient outcomes. Beyond antibacterial effects, tetracyclines also exhibit anti-inflammatory properties. They suppress polymorphonuclear leukocyte activity, particularly the scavenging action of reactive oxygen metabolites. Additionally, tetracyclines may block icosahedron synthesis by inhibiting phospholipase A2 activity. These actions help reduce inflammation and tissue damage, making tetracyclines useful in managing chronic inflammatory conditions. Treatment of dentin with tetracyclines enhances fibroblast attachment and colonization. This means tetracycline can condition the root surface and influence the attachment properties of fibroblasts, which are crucial for tissue regeneration. The drug's substantivity, or its ability to bind and release from dentin, is proportional to its concentration. This feature supports its use as an adjunct in treating periodontitis, especially in localized juvenile and refractory cases. Tetracyclines enhance fibronectin binding, which is important for cell adhesion and tissue repair. This property further establishes their role as adjuncts in periodontitis treatment, maximizing their effect in patients with localized juvenile and refractory periodontitis. The ability to improve cell attachment and healing makes tetracycline a valuable tool in dental therapy. Like all medications, tetracycline comes with potential adverse effects. Understanding these risks is essential for safe use. The most common side effects include gastrointestinal disturbances, overgrowth of resistant organisms, and photosensitivity reactions. Being aware of these issues helps patients and healthcare providers make informed decisions about tetracycline therapy. Tetracycline can cause a range of gastrointestinal issues including diarrhea, nausea, vomiting, and severe colitis. These symptoms may affect patient compliance and comfort. It's important to monitor for these effects and adjust therapy if necessary, ensuring that the benefits of treatment outweigh the risks. Another concern with tetracycline use is the overgrowth of resistant organisms. This can lead to conditions such as stomatitis, vaginitis, and staphylococcal enterocolitis. These secondary infections may require additional treatment and highlight the importance of antibiotic stewardship. Tetracycline can cause photosensitivity, leading to skin rashes and hypersensitivity reactions. Patients should be advised to avoid excessive sun exposure and use protective measures while on tetracycline therapy. Recognizing these reactions early can prevent more serious complications. Certain conditions contraindicate the use of tetracyclines. These include pregnancy, breastfeeding, renal impairment, hepatic disease, and systemic lupus erythematosus. Understanding these contraindications is vital for patient safety and preventing serious adverse outcomes. Tetracycline is contraindicated during pregnancy due to the risk of staining deciduous teeth and impaired bone growth in the fetus. These effects can have long-term consequences, making it essential to avoid tetracycline in pregnant women. Alternative antibiotics should be considered to ensure both maternal and fetal safety. Breastfeeding mothers should avoid tetracycline as it can cause staining of developing teeth and gastrointestinal disturbances in children. These risks underscore the importance of careful antibiotic selection during lactation to protect infant health. Patients with renal impairment should not use tetracycline as it can aggravate uremia. This condition can worsen kidney function and lead to serious health complications. Monitoring renal function and choosing safer alternatives is crucial for these patients. Tetracycline is also contraindicated in patients with hepatic disease. The drug can exacerbate liver dysfunction, making it unsafe for those with compromised liver health. Proper assessment and alternative therapies are recommended for these individuals. Patients with systemic lupus erythematosus may experience exacerbation of lesions when taking tetracycline. This risk highlights the need for careful patient evaluation and avoidance of tetracycline in those with autoimmune conditions. Within the tetracycline group, several agents are commonly used in periodontal therapy: tetracycline, minocycline, and doxycycline. Each has unique properties, dosages, and side effect profiles. Understanding these differences helps tailor treatment to individual patient needs. Tetracycline itself requires administration of 250 mg 4 times a day. While it is inexpensive, the frequent dosing can reduce patient compliance. This dosage regimen is important to remember when prescribing tetracycline, as adherence is key to successful treatment. Minocycline is a semi-synthetic tetracycline with a broad spectrum of antibacterial activity, especially effective in adult periodontitis. The recommended dosage is 200 mg twice a day for 1 week. Side effects include reversible vertigo, which should be monitored during therapy. Doxycycline shares the same spectrum of activity as minocycline. Its absorption from the gastrointestinal tract is not affected by calcium, metal ions, or antacids, making it more convenient for patients. Dosage typically starts with 100 mg twice on the first day, followed by 100 mg once daily or 50 mg twice daily for 4 days. Tetracyclines are widely used in periodontal therapy due to their ability to concentrate in gingival crevicular fluid and inhibit tissue breakdown. Their role in managing gum disease and supporting tissue regeneration makes them a cornerstone in dental treatments. Tetracyclines are effective against a broad spectrum of bacteria with greater efficacy against gram-positive organisms. This wide-ranging activity makes them suitable for various infections, though resistance can develop with overuse. Overuse of tetracyclines can lead to the development of resistant bacterial strains. This resistance reduces the effectiveness of the drug and complicates treatment. Responsible prescribing and adherence to guidelines are essential to combat antibiotic resistance. Substantivity refers to tetracycline's ability to bind to and release from dentin. This property is proportional to the drug's concentration, not the duration of application. Substantivity enhances its effectiveness in periodontal therapy, supporting long-lasting benefits. Tetracyclines are often used as adjuncts in treating periodontitis, particularly in localized juvenile and refractory cases. Their ability to enhance fibroblast attachment and inhibit tissue breakdown makes them valuable in comprehensive dental care. Proper timing of tetracycline administration is crucial for optimal absorption. Taking the drug half an hour before or after food prevents chelation with dietary calcium, ensuring maximum effectiveness. Patient education on timing can improve treatment outcomes. Tetracyclines help maintain bone health by inhibiting bone resorption. Their antiproteolytic and anticollagenase actions protect bone tissue from hormonal and bacterial damage, supporting overall skeletal integrity. By suppressing leukocyte activity and blocking icosahexaenide synthesis, tetracyclines reduce inflammation. This dual action is beneficial in chronic inflammatory diseases, providing relief and preventing further tissue damage. Tetracycline's ability to enhance cell attachment, particularly fibroblasts, supports tissue healing and regeneration. This property is especially useful in dental procedures where tissue repair is critical for recovery. The high concentration of tetracycline in gingival crevicular fluid makes it particularly effective for periodontal disease. Its targeted action helps resolve infections and inflammation, improving oral health outcomes. Managing tetracycline's side effects involves monitoring for gastrointestinal disturbances, resistant organism overgrowth, and photosensitivity. Early detection and intervention can minimize complications and support patient adherence. Frequent dosing and side effects can challenge patient compliance with tetracycline therapy. Educating patients about the importance of adherence and strategies to manage side effects can improve treatment success. In cases where tetracycline is contraindicated, alternative antibiotics should be considered. These alternatives can provide effective treatment while minimizing risks, especially in vulnerable populations like pregnant women and those with renal or hepatic impairment. Regular monitoring during tetracycline therapy is essential to detect side effects, resistance, and ensure effective treatment. Healthcare providers should assess patient response and adjust therapy as needed for optimal outcomes. Tetracycline's unique properties make it a valuable tool in oral health, particularly for managing periodontal disease and supporting tissue regeneration. Its targeted action and adjunctive benefits enhance dental treatment outcomes. To summarize, tetracycline offers antibacterial, anti-inflammatory, and tissue-supporting actions. Its effectiveness in periodontal therapy, bone health, and inflammation suppression makes it a versatile antibiotic. However, careful consideration of side effects and contraindications is essential for safe use. Following safe use guidelines for tetracycline involves proper dosing, timing, monitoring, and patient education. Adhering to these principles ensures effective treatment while minimizing risks and complications. Research continues to explore new uses and modifications of tetracycline, aiming to enhance efficacy and reduce side effects. Advances in antibiotic development may lead to improved therapies for periodontal and other diseases. Educating patients about tetracycline's benefits, risks, and proper use is vital for successful therapy. Clear communication and support can empower patients to adhere to treatment and recognize potential side effects early. Responsible use of tetracycline is part of broader antibiotic stewardship efforts. Limiting unnecessary prescriptions and monitoring resistance patterns help preserve the effectiveness of this important drug for future generations. Tetracycline remains a valuable antibiotic with diverse actions and applications. Its role in periodontal therapy, bone health, and inflammation management is well established. By understanding its properties, side effects, and safe use guidelines, healthcare providers and patients can maximize its benefits while minimizing risks. Thank you for joining us on this comprehensive journey through tetracycline.